Nail biting, anxiety habit, or immune training. Nail biting has long been cast as one of those undesirable habits you're supposed to outgrow, like nose picking or telling people you want to be a dinosaur when you grow up. It's often lumped in with signs of nervousness, boredom, or stress, and usually earns a scolding glance from parents, teachers, or even the occasional stranger who's a little too invested in your cuticle health. But while biting your nails might not win you any awards for social grace or manicure aesthetics, it may come with an unexpected evolutionary twist. Your fingers could be sneaking your immune system into boot camp. Now, let's be clear. This isn't a green light to gnaw your way to the knuckle. Chronic or aggressive nail biting can cause real damage, from infections to dental problems to straight-up painful hangnails. But in its milder, more occasional form, this behavior might actually be doing something oddly useful by delivering microdoses of environmental bacteria straight to the mouth, where your immune system first meets and greets the outside world. Think of it as the immune version of exposure therapy. The mouth and gut are key arenas of immune activity, lined with lymphoid tissue that constantly surveys everything you eat, breathe, or accidentally stick in your mouth. By bringing in small amounts of dirt, skin flora, and whatever else is clinging to your fingertips, nail biting might be offering your immune system a low-stakes training session, a chance to recognize harmless microbes, learn what's normal, and fine-tune its response before a real threat shows up. It's like immune flashcards, only grosser. This isn't just theoretical. Some observational studies have found that children who bite their nails or suck their thumbs may be less likely to develop allergies later in life. The idea is that early and consistent microbial exposure may steer the immune system away from hyperreactivity, aka that annoying habit of mistaking dust or pollen for public enemies. It supports the broader hygiene hypothesis, which suggests that overly sterile environments might actually make the immune system more prone to overreact, since it hasn't had enough real-world practice. So, could mild nail biting be nature's weird little way of inoculating us against an overzealous immune system?
Possibly.
It's certainly not the cleanest method, but evolution rarely bothers with clean. It's efficient, not polite. If nibbling the occasional nail helps your immune system gain a broader microbial vocabulary, it might explain why the habit has stuck around in so many people, across ages, cultures, and stress levels. Of course, there's a balance. Regular nail biting can break the skin and create pathways for harmful bacteria, not just the training kind. It can damage tooth enamel, transfer nasty stuff like fecal bacteria or cold viruses, and let's face it, it's not the most attractive look in a job interview. But perhaps instead of treating nail biters like walking health hazards, we can start to view them as amateur immunologists, albeit ones with slightly ragged hands. So the next time you catch yourself gnawing at a fingernail during a tense movie, an awkward conversation, or a long meeting, don't be too quick to scold. Sure, it's not ideal, but there's a chance your subconscious is doing more than just dealing with anxiety. It might be throwing your immune system into a pop quiz it never asked for, but might secretly appreciate. In the end, nail biting might be both an anxious tic and a microbial gamble. Not exactly glamorous, but possibly adaptive in its own bizarre, slightly unhygienic way. Just, wash your hands first.